As a physiotherapist, we don't just look at where a patient might be complaining about pain, but we want to look at the why. And this concept around the why becomes really apparent, right? When we're looking at the relationship of the shoulder blade to the shoulder joint. In other words, the scapulohumeral rhythm. Before I begin though, my name is Eric Hammer, also known as the functional physiotherapist. And my purpose and passion is helping other physiotherapists to understand the importance of taking a functional active approach in terms of rehabilitation with our patients in order to provide lasting changes for our patients. So I wanted to talk a little bit about this concept of the importance of scapular rhythm and again, how it can impact the shoulder function. So in particular, right, when we're looking at different issues where it might be a rotator cuff or some sort of bursitis within the shoulder, where we really want to look at the full picture of how the shoulder is moving, and in particular, areas around the scapula, areas around the thoracic spine and neck, to really determine the underlying why of the pain versus, hey, you know what? Somebody's complaining about lateral shoulder pain. It must be the rotator cuff. And you know what? Let's just do some ultrasound, or maybe we just strengthen that particular area. But really looking at it from a matter of movement dysfunction and what might be going on in these other areas that impact the shoulder in terms of movement through the scapular rhythm, compensations of certain type, thoracic extension, and strength in those scapular stabilizer muscles. So, for example, if we're seeing a patient where the scapula doesn't sit nicely on the rib cage, is there a weakness in some area? Is there a weakness in, again, some of the scapular stabilizers? If it's a patient who has a very kyphotic posture, right? So when you assess their overall posture, is it a patient who's simply in this kind of slouched position? Maybe a patient who sits at the office, sits at the computer for a long period of time, and then they're kind of that weekend warrior, right? That individual who goes out and maybe they're sitting all day for 8 hours and then they go play volleyball, right? And they're doing these overhead movements in the evening time. So really trying to assess the movement that can be generated, right, when the patient is lifting up their arm. And again, are they stuck in more of a kyphotic position? Do they have limitations in the thoracic spine? Is there some tightness perhaps in the pecs that might be contributing? And again, looking at the motor control of the shoulder. Is the scapular, is it positioned upwards? Is there an overuse, let's say, of some of the, perhaps the upper traps or some of the muscles in through the neck? Might there be a forward head posture, right? And again, an elevation, let's say, of the shoulder blades that might be contributing. So really looking and again, changing this concept from, oh, okay, here's where the pain is, to we're going to look at the overall movement, compensation, restrictions, and the general quality and the goals of what the patient wants to achieve versus looking just specifically at where the pain is. If you're a physiotherapist and you're interested in this sort of functional active approach in terms of rehabilitation, feel free to look at my course. It's called From Passive to Powerful, and it's a course that really dives into the specifics around an active rehab approach. If you have any questions, concerns at all for me, feel free to leave a comment below. And please make sure that this material is appropriate for you. Thanks again for watching, and have a great day. Take care.